Assure newly appointed service chiefs of the necessary legislative backing.
Federal Executive Council approves 20 new private universities.
Rapists to get the death penalty in Kebbi State, while kidnappers face life in prison.
On Good Morning Nigeria today, our focus is on World Cancer Day.
Globally, 1 in 5 persons may develop cancer in their lifetime, with more infections in women.
The International Agency for Research on Cancer estimates that more than 50 million people are living with cancer, and the risk factors driving this increase include age and socio-economic issues.
Now, the most common of these is breast cancer, which occurs in 1 in 4 women, while others such as colorectal, lung, cervical, and thyroid cancer follow closely behind.
In men, however, lung and prostate cancer account for almost 1/3 of all forms of cancer. And reports also indicate that the global cancer burden rose to over 19 million cases, with 10 million fatalities in 2020.
Now, the National Cancer Control Program of the Federal Ministry of Health coordinates Nigeria's response to the challenge, and 75% of funds required for the management of the country's response is provided by the federal government, while 25% is sourced from donors and development partners.
Now, since 2019, the focus of the global fight against cancer has been on collective effort by stakeholders in the reduction of the cancer burden, while a consultative process was adopted in the development of Nigeria's cancer control plan.
How much impact has the National Response Plan for Cancer made in Nigeria? Are more Nigerians open to cancer tests today? What projections should the National Cancer Program be making for the country?
Well, these are some of the issues we intend to address as we discuss World Cancer Day, which has been marked globally on the 4th of February. On that note, we'll say welcome to Good Morning Nigeria. I'm Kingsley Osadola, thanking you for tuning in.
And I'm Kirian Umayo. Welcome to the program. We're reaching you live on the network service of the NTA. And as usual, we have the complimentary segment, which will include newspaper review, business, and indeed others. Now, let's join Musbao Danwahab for the morning news. Good morning, Musbao.
So very good morning, Kirian and Kingsley. The news. The Speaker of the House of Representatives, Femi Gbajabiamila, is assuring the newly appointed service chiefs of the necessary legislative backing to the nation's armed forces in the task of dismantling obstacles to national security and stability for a prosperous Nigeria. The Speaker gave the assurance while speaking to journalists after an audience with President Muhammadu Buhari.
House, Senate, public, and the President took his time, and he studied the situation very well, and he did it at the right time that he thought he should do it. So we're all in support of what he has done. We are all in this situation together. The National Assembly will not in any way put hurdles before the service chiefs. We will make the working environment suitable for them to be able to discharge their responsibility and discharge it very efficiently.
The Federal Executive Council has approved the establishment of 20 new private universities in the country. Amongst them is Mariam Abacha American University of Nigeria, Kano. The Minister of Education, Adamu announced this while briefing journalists after the Council's meeting presided over by President Muhammadu Buhari. Approvals have also been granted towards enhancing the nation's industrialization drive, transportation, as well as aviation safety and security.
They will now get their provisional licenses, which they will use for the next 3 years while we are monitoring and evaluating how they are going.
The Kebbi State Attorney General and Commissioner for Justice Ajia Rahmatu Adamu Gulma says henceforth anyone convicted for rape will face the death penalty while kidnappers will get life in prison. The decision, she says, is to serve as deterrent to criminals in the state.
So the idea is for it to serve as deterrent to other intending offenders. Whoever intends to commit kidnapping, because apparently some people are seeing it as a business. So if you know that this business, once I do it and I get caught and convicted, I'm going to face death sentence, I think people will think twice before they do that.
In politics, Chairman, Lagos State Chapter of the All Progressives Congress, APC, Tunde Balogun says the registration and revalidation of members will enable the party have another reliable register. The state chairman gave an indication as the chapter strategizes to ensure each free exercise.
Registration will really be on the 9th of February, Tuesday 9th of February, and that will be next week. We are preparing for that by training people who will do the registration because new members have come in. Those who are of age now, 18 years old, have been brought in. Some have died. Those ones have been deleted by this kind of process.
A mobile court sitting at the Eagle Square, Abuja, has ordered the unsealing and reopening of Wuse markets, UTC, and more shopping plazas. This followed a plea of leniency entered by the traders and market management before the magistrates.
We hope to maintain and continue with the process.
The members of this complex will comply with the protocol.
The markets have tested the very bitter pills. The mobile court is getting overstretched. So if you look at it from all perspectives here, the area is getting real serious when it comes to enforcement.
In its latest statistics, the Nigeria Center for Disease Control, NCDC, has confirmed 1,138 new cases of COVID-19 in 20 states and the FCT. Lagos has 377, FCT 172, Plateau 86, Kano 84, Edo 60, Osun 47, Nasarawa 41, Imo 40, Rivers 36, Niger and Oyo State recorded 32 new cases each, while Borno has 29, Kaduna 27, Delta 18, Kwara 17, Cross River 9, Ekiti 8, Bauchi and Ogun State recorded 7 new cases each, as Sokoto 6 and Bayelsa got 3 new cases. So far, Nigeria has 134,690 confirmed cases of COVID-19, out of which 108,657 were treated and discharged, while 1,608 deaths are on record so far. And that concludes the morning news and Good Morning Nigeria. The program will continue in just a moment with Kirian and Kinsley.
It's now time for business report, and Comforter Modu has details of developments in the economy.
The outlook for oil remains brighter, with demand estimated to rise by 3.3 million barrels per day. OPEC emphasized the positive contributions of the Declaration of Cooperation in supporting a rebalancing of the global oil market at a joint technical committee meeting of the OPEC in Vienna, Austria. The 26th meeting of the Joint Ministerial Monitoring Committee, held virtually, observed that in December 2020, stocks in Organization for Economic Cooperation and Development countries had fallen for the 5th consecutive month, noting that the economic prospect and oil demand would remain uncertain in the coming months, and the gradual rollout of vaccines around the world is a positive factor for the rest of the year, boosting the global economy and oil demand.
For 2021, demand is still expected to expand by about 5.6 million barrels a day, with the extended lockdowns in a number of countries impacting demand in the transportation sector in particular. The focus for 2021, however, is just about 0.6 million barrels a day, with expansion impacted by lower investments and increasing fiscal discipline, especially in the shale basins of the United States. The main contributors to non-OPEC supply growth in 2021 are still expected to be Canada, Brazil, Norway, and to some extent, the US.
And here are the closing figures for trades on the floor of the Nigerian Stock Exchange. With Business News, Comfort Amodu.
Thank you very much, Comfort Amudu, for the business package. Newspaper review is next for us.
And here we have Bayo Atoebi, the GMN newspaper reviewer. Bayo, good morning and welcome.
Thank you, Kiriel. Good morning. Good morning, Kinsley.
Right,
good morning,
good
Nigeria.
to see you.
Thank you.
Okay, let's begin by taking a look at the front page of the Nation newspaper. And above the nameplate, it says, abductors kill U.S. returnee after ransom collection. Protesters block highway. Details on page 5. Abductors kill U.S. returnee after ransom collection. This occurred in Edo State. They were traveling from Fuga, that's Edo North, to Lagos, and their Sienna minivan was accosted by kidnappers on the bypass, and they took out all the passengers in the vehicle, typical style of the kidnappers. And while they were being marched into the forest, the victim was said to have been unable to keep pace, following from which the abductors shot him to death at that point. 63 years old, you know, he came from Atlanta for the Christmas and New Year holidays. He was from Fuga, that's in Edo North of the state. But after that, they collected ransom still from his family. Autumn 6 AK-47 rifle licensing for Nigerians. That's on page 3. Zulum inaugurates 6 billion naira Meduguri-Bama Road. Niger youth protest incessant killings. Nigerian stocks lose 216 billion naira in 3 days. EFCC quizzes ex-governor Yari for attempting to move 300 billion naira. FEC okays 20 private universities. NBA begins boycott of cult in Kebbi. Khan and Islamic Council to DSS go after killers and others. With a rider, secret police raised the alarm on plans to cause ethno-religious violence. And there's an excerpt from the story which is also highlighted there on the front page of the paper. And it is as follows. Terrorists, bandits, kidnappers, and other criminals are not invincible. Things are becoming increasingly complicated daily. Criminals are operating as if our security agencies are on holiday. Caretaker leadership in APC abnormal, says Akonde. That's the pioneer chair of APC's ex-interim chair, membership registration wasteful. Party, we hold Akonde and Tinubu in high esteem. No plan to feed Jonathan in 2023, says ruling party. Cancer cases double in 20 years, says WHO. That is right at the foot of the front page. And gunmen kill policeman, kidnap 3 Chinese. Details on page 6. Here.
All right, now let's turn to the Daily Trust newspaper. Daily Trust newspaper. Now, court asked to stop Adamu from parading himself as IGP. That's on page 7. Academics express cautious optimism as federal government licenses 20 private universities. It's on page 18. APC membership registration and aberration, according to Akonde. It's on page 24. World Cancer Day, that's the kicker for the lead story. Only 3 public radiotherapy centers in Nigeria. Patients decry high treatment costs. Federal government yet to redeem care center pledge. Experts want treatment captured in NHIS. Now, the photo story is that of members of the Nigerian Union of Pensioners who are protesting non-payment of their pension arrears in Gombe State. All right, and below that we have no ethnic group should lord it over others. That's according to Majabi Amila, Speaker of the House of Representatives. Teenager wants surname changed after being raped by dad. That's unbelievable. You know, it's one of those things where I say, well, if it's in Kebbi, the man will be going for the death sentence, according to what we just saw this morning. Police kills 3 bandits in Katsina. In page 6. Now, why Nigeria can't export beans to Europe? It's captured on page 17 of the Daily Trust newspaper. Let's now go to Bayo for further analysis.
Thank you, Kirian. Let's draw attention to the concerns being expressed about threat to peace and peaceful coexistence in the country. The Northern Elders Forum has expressed concern over reports of ejection, threats, and attacks of herders' families and communities in some states in the south. The statement by Dr. Hakim Baba Ahmed advised the threatened herders to seek protection and resist temptation to take laws into their own hands. He says all Nigerians are enjoined to exercise restraint and not to pander to pitching citizens against one another. The Nigerian police is called upon to live up to its constitutional responsibility to detect crime and arrest and prosecute criminals, whoever they are. The Department of State has also warned that some group of persons are exploiting fault lines to cause ethno-religious violence in parts of Nigeria. Peter Afunaya, the spokesperson for the department, says intelligence showed that some moves by some groups are intended to subvert public order by first of all resorting to inciting people, unguarded and divisive statements, and acts that are pitching one set of citizens against another. The targeted states have been identified as including Sokoto, Kano, Kaduna, Plateau. Others are Rivers, Oyo, Lagos, and the southeastern states. The department warns that all should stop inflaming the embers of tribal and religious discourse and face the full wrath of the law if they persist. This is the second time the DSS is issuing a warning. It may be recalled that on January 11th, a similar warning was issued. But meanwhile, religious organizations have also reacted. The nation has indicated that the Supreme Council for Islamic Affairs, as well as Christian Association of Nigeria, have also reacted. Christian Association has challenged the DSS to quit issuing security alarms, but rather take action to apprehend and prosecute those allegedly responsible for security breaches. Media statement by Pastor Bayo Oladeji on behalf of Christian Association of Nigeria says that DSS should wake up to its statutory responsibility of bringing perpetrators of violence crimes to book. The responsibility for security breaches such as terrorism, kidnapping, banditry, and killing of innocent citizens should be apprehended and prosecuted. Meanwhile, the Speaker of the House of Representatives, Femi Gbajabiamila, has warned that no ethnic group should seek to dominate the other. He enjoyed mutual respect for each other for the sake of peace and harmony. He was speaking after meeting with President Muhammadu Buhari, and he indicated that the House of Representatives, upon resuming from their current recession, will work on legislation aimed at resolving contentious issues. On the side of the Constitution, the Senate Ad Hoc Committee on the Review of the 1999 Constitution says that the review of the Constitution will be in progress. The Deputy Senate President, who is also chairman of the review, Senator Ovia Omar Agege, says that the review will include analysis of the 2014 National Conference, the All Progressive Congress Committee report on federalism, as well as several other memoranda that is with the committee. He says that these are to be translated into constitutional amendment. He disclosed this at a 2-day retreat on the review of the 1999 Constitution. The Federal Capital Territory Task Force on COVID-19, yesterday, dispersed persons who had gathered for promotion exam of staff of the Nigerian Social Insurance Trust. Staff from the North Central Zone covering Niger, Kwara, Kogi, and Nasarawa State, numbering about 1,200, had gathered at an event center to sit examination. They were asked to disperse because they had no permission. There, many of them were found not wearing face masks properly. Others were not observing social distance. The organizers of the examination claim they had sought permission, but the task force insisted that permission was not sought. If they had permission, they should provide evidence of it. Such evidence were not made available. Meanwhile, the mobile court that supports the task force on the COVID-19 for the FCT has now granted reprieve for the opening of the FCT market as well as the UTC market and the plaza. They were, however, fined to pay 50,000 naira each, and they has assured that they are going to put in place measures to observe COVID-19. As of today, 1,138 cases were reported for COVID-19. Lagos is still leading with 377. Total cases now 134,690. Those on treatment in various centers are 24,415. If you look at that across the nation, divided by 36 states and the FCT, it means we have a minimum of 660 persons being treated for COVID-19 in all states.
Minus Kogi State.
Oh, okay. Well.
All right, Bayo, you didn't complete the aspect of the raid of the Promotion Exam Center here in the Federal Capital Territory yesterday by the FCT task force on the enforcement of COVID-19 protocols. Two directors were said to have scaled defense when the task force men arrived, because they were looking for them to say, look, who was organizing this exam, who said that you had a permit to crowd the place without social distancing and no face mask and all that. They wanted to take them away, but I think some of the union leaders, prevented that. And in the process of seeking to identify who the bosses were, there was an account that two of the bosses scaled the fence. Maybe they scaled the fence into the hotel or scaled the fence into the International Conference Center. Perhaps their identities will be disclosed later. They should have waited for the consequences.
Yes. Well, it goes to emphasize the fact that we cannot take the non-pharmaceutical protocols for granted. It is put in place for our own safety. And anytime we abandon it, we are risking ourselves and other persons' safety to health.
That's right. Bayo, very quickly, there's two stories here I would like us to probably just comment on briefly as well. Autumn 6 AK-47 rifle licensing for Nigerians. AK-47 is it's a high-caliber assault weapon.
Yes, self-reloading automatic weapon.
It's an assault weapon. It's not like a handgun that you have a Beretta pistol or a Magnum and so on. So if Nigerians will now be carrying AK-47 all over the place?
It become another America.
I'm just wondering.
Well, let me in support of AK-47, as a brand, that should be carried. But if they're smaller guns or they're short guns, well, I'm not an advocate of that. But in the face of what's happening today, kidnapping here and there, kidnappers know you don't have anything. But if people are licensed to have guns, responsible people are licensed to have guns, a kidnapper will think twice before he carries out any kidnap operation, knowing full well that he could be shot down in the process. In any case, we could say that we're not matured, matured to have guns and all of that. But I'm not sure he's not totally out of point, because these days you're not sure what's going to happen to you. You can't travel anywhere across this country without being scared or being kidnapped. There's no road that is free. There's no road in this country, no highway in this country right now is free. No highway, none, not even one. So how many of us will have to fly? How many of us have the money to fly? Right. So that's the danger.
Well, you see, I think the concern expressed by His Excellency the Governor is about the level of insecurity. However, even within the society, under normal circumstances, persons are granted license not for automatic weapons. It is for rifles and others that are meant for game. Even then, when security threat becomes very heightened, they are even asked to return those licenses in order not to keep the level of gun violence down. So I think there's a need to be circumspect about that.
Absolutely.
The concern is about the heightened insecurity across the nation.
Yeah, but I know that you are itching to raise some other issues. There's this one on the front page. FEC, yes. That's the Federal Executive Council, OK's 20 private universities. You have it on page 8. Yes. My concern, of course, we have 99 private universities now with the latest round of licensing. Why, the way are we beginning to have challenges with getting the names of universities? I will give you an example. 2 of the universities that were approved yesterday, one of them is Clayton University of Nigeria, Nekede, Imo State. The other one is Mariam Abacha American University of Nigeria, Kano. In law, there's what is called passing off. Why University of Nigeria? There's only one University of Nigeria established by an act of parliament. So if you're looking for a name, first of all, I think that part of the process ought to be name search or name availability, as you would do with the Corporate Affairs Commission, so that a name doesn't closely resemble another. You could give it, the university is already here in Nigeria, so why say Clayton University of Nigeria, Nekede? If you remove the Clayton, somebody will think that it's UNN. There is only one UNN, and I'm sure you know the part of the reason why I'm being sentimental about it.
I can understand. An alumnus of UNN will be sentimental about it. But it's not unconnected to the fact that it is the statutory name of the entity that applied for the license.
All right, Bayo.
No, but your name cannot closely resemble another.
Let's end it here.
Don't pass it off.
Let's end it here, Kingsley. We know you are of the University of Nigeria, Suga. We agree to that. Then there's nothing in the name. Perhaps when they commence operation, we'll be able to know more about that. So on these notes, I have to thank Bayo for being here this morning as always. Thank you for your analysis. We hope to see you again tomorrow for more analysis on National Dailies. This is Good Morning Nigeria. You're welcome back. Now, to begin our conversation on the subject matter, let's take this report put together by Oyeyemi Ajayi.
Cancer is a group of diseases involving abnormal cell growth with the potential to invade or spread to other parts of the body. Possible signs and symptoms include a lump, abnormal bleeding, prolonged cough, unexplained weight loss, and a change in bowel movement. World Health Organization says cancer is the second leading cause of death globally, with an estimated 9.6 million deaths, or 1 in 6 deaths in 2018. Lung, prostate, colorectal, stomach, and liver cancers are the most common types of cancer in men, while breast, colorectal, lung, cervical, and thyroid cancer are the most common amongst women. Globally, the lung cancer is said to be the leading cause of cancer death among men because of its high fatality rate, followed by prostate cancer and liver cancer. Projected total of over 1.8 million new cancer cases and 606,520 deaths in 2020 globally, with approximately 4,950 new cases and 1,600 deaths each day. The cancer burden continues to grow globally, exerting tremendous physical, emotional, and financial strains on individuals, families, and communities, as well as health systems. Many health systems in low and middle income countries are said to be least prepared to manage this burden, and a large number of cancer patients globally do not have access to timely quality diagnosis and treatment. As the world marks this year's World Cancer Day on 4th February with the theme I Am and I Will, which is a reminder that each one can play a role in reducing the impact of cancer. How far have researchers gone in coming up with cure for the disease, knowing well that cancer has no known cure? What more are the preventive measures against the disease? How possible is it to have a cancer-free world and nation? These are some questions begging for answers from guests already seated in the studio.
Thank you very much, Oyeyemi Ajayi, for that backgrounder. Indeed, we already have our guests here in the studios, as well as the guests who are joining us via Zoom from different locations. First, let's welcome Here in the Abuja studios, Dr. Adamu Al-Hassan Umar is President, Nigeria Cancer Society. Dr. Umar, pleasure to have you with us this morning.
Thank you very much for having me. Good morning, viewers.
Let's also welcome a regular guest on Good Morning Nigeria, Dr. Bello Abubakar. Is Chief Consultant, Clinical and Radiation Oncologist at the National Hospital, and also President of the African Organization for Research and Training on Cancer. Dr. Bello, pleasure to have you again on Good Morning Nigeria.
Thank you for having me. Good morning, Nigerians.
And joining us via Zoom is Dr. Zainab Shinkafi Bagudu, wife of Kebbi State Governor and founder Medicaid Cancer Foundation. Madam, you're welcome to the program.
Good morning. Nice to see you again.
Also via Zoom from Lagos is Senator Lanre Tejiosho, former chairman, Senate Committee on Health. Good morning and welcome to the program.
Thank you. Good morning. Thanks for having me.
And Dr. Ami Balt, Assistant Professor of Medicine and Genetics at Stanford University and Director of Global Oncology, Stanford Center for Innovation in Global Health, co-founder Global Oncology Incorporated. It's also a pleasure to have you join us this morning on Good Morning Nigeria.
It is a pleasure. Good morning, Nigeria, and good evening from the United States.
All right, thank you indeed.
All right, good evening. That's presumably, therefore, that's Pacific time, I believe, in the U.S.
Exactly.
That will be some 9 hours behind us. So we thank you for being with us at this time. Let's begin the conversation with the president of the Nigerian Cancer Society. That's Dr. Adamu Al-Hassan Umar. It's another World Cancer Day. What are the issues in this year's, shall we say, celebration? Because, I mean, any person who has cancer couldn't possibly be celebrating anyway, unless, of course, you're on the path to recovery. What are the issues in this year's World Cancer Day?
Well, thank you very much once again for having me. Good morning, viewers. Today is World Cancer Day. It is a day set aside as an initiative of the Union for International Cancer Control to celebrate every year, to consolidate on achievements and map out appropriate next steps. This year, the theme is I Am and I Will, and it is actually a 3-year impact-driven campaign that started in 2019. We are consolidating this year in 2021, being the last year of the I Am and I Will theme of the World Cancer Day celebrations. The I Am and I Will spirit is in all of us. It is a global call for action for all stakeholders in the cancer space, not only those working directly on cancer and cancer-related ailments, to take it as a personal responsibility to contribute, to make their voices heard, to bring out the issues, and to map out strategies on how best to complement and contribute towards cancer prevention, early detection, treatment, and care. So today we are celebrating World Cancer Day in order to reawaken our consciousness, in order to re-emphasize the global-driven initiative, the impact campaign that was started in 2019, to consolidate on the achievements that have been recorded over the past 3 years, and consolidate and find ways to move forward, because to us, every day is World Cancer Day. And what has been recorded over the past 3 years will be used as a fulcrum as we continue to sustain the preaching of gospel on cancer prevention, early detection, and treatment. Thank you very much.
All right, thank you indeed. Well, we say we celebrate cancer. I'm not sure. Is it really celebration or something?
Well, sir. We mark World Cancer Day.
All right. I Am and I Will. It happens to be the theme of this year's, cancer celebration, if you like. Now, you have told us about the fact that it is to awaken our consciousness and, of course, to consolidate on the achievements of the past 3 years with respect to the fight against the cancer. Yes. All right. Now, let's go to Dr. Zainab Shinkafi Bagudu, wife of the Kebbi State Governor and founder of Medicaid Cancer Foundation. Now, madam, there are many foundations that are focused on cancer, and I want to share with you what your foundation does, specifically does, with respect to the fight against cancer. Now we're talking about cancer, World Cancer Day. We are marking World Cancer Day today with the theme, I Am and I Will. How do you incorporate that into your foundation? And let us also know some of the activities of your foundation?
Okay, thank you. That's a very general question. I wear many caps, one of which is I sit on the board of the UICC as a director. And like you heard from Dr. Hassan, our president, the UICC is the ultimate global body that championed the World Cancer Day. So today I'm going to wear that cap and many other ambassadorships that I hold, such as the Cervical Cancer Free Nigeria campaign. We all join hands together in the theme of the I Am and I Will, which has been the campaign for the last 3 years, to try to amplify the conversation about cancer in various ways, to influence policymakers, to influence our people, the communities in the cities and in the grassroots, to try to educate our children, youth, and even the elderly all about what cancer is, how to prevent it, and how to treat it, how to access treatment. We try to speak to the government policies so that we can have better facilities and better chemotherapy centers all over the world, particularly in low and middle income countries. And the theme of I Am, I Will this particular year ends with together all actions matter. So all of us here in our various capacities are coming together to try to improve the cancer control around the world. Today we'll be visiting quite a few cancer patients, dispersing some funding which we raised last year, but due to the COVID-19 pandemic, which has thrown so many challenges at every facet of health and our lives, we were unable to have our usual disbursement. So we'll be doing it today and launching the Orange Box. We're starting, which is a method that is easily adapted to screen women for cervical cancer. There is a global strategy to try to eliminate cervical cancer.
Well, it looks like the audio there is fading from the Zoom connection that we have to Her Excellency, the wife of the Governor of Kebbi State, Dr. Zainab Bagudu. Once that is cleared up, we'll get back to her to get her further thoughts on this topic. Let's also now go over to Senator Lanre Tejuosho, who's the former chairman of the Senate Committee on Health. You saw him earlier when we introduced him via Zoom. Senator Lanre Tejuosho, well, this is the last year, as it were, for the I Am, I Will celebration. And as the president of the Nigerian Cancer Society indicated, we're looking at some of the accomplishments that have been made since the rollout of the theme in 2019. What would you say for us in Nigeria have been the milestones in seeking to realize the objectives of the theme of I Am and I Will, particularly from the legislative point of view?
Yes. The focus of our own foundation today is cervical cancer, which is a cancer that we actually have vaccines to help the children to prevent it. And to get this distribution of vaccine properly in the country, we need to strengthen our primary health centers. And concerning the policymakers, that is the parliamentarians, the funding of the primary health centers and the guarantee of their capacity to be able to undo the vaccination process is a very important priority for the policymakers in terms of funding. And the issue of vaccine is now very popular all over the world, especially with the COVID situation. And cervical cancer vaccination has been very much important before the advent of COVID. The advocacy now is more important than even before to ensure that the issue of vaccine of other diseases is not disturbing the advocacy for cervical cancer. So I believe we are definitely ready to ensure the distribution through our primary health centers is going to be a very achievable thing now that the funding is even increased with the COVID vaccination processes.
All right. Kieran?
Well, yes. Part of the question Kinsley put to you had to do with the idea of letting us know what has been done from legislative point of view. First of all, we don't have enough cancer centers in Nigeria. And while you were the chairman of Senate Committee on Health, we know, the milestone, that you could say that have been achieved, by your committee with respect to ensuring that the fight against cancer is heightened. Not just cervical cancer, there are other, breast cancer, we have prostate cancer, especially prostate cancer, which of course deals with men. So may we just know further on this issue of legislature, what has been done in this respect?
Well, for your information, I'm not the chairman of the committee now. I left 2019 May. All I can say is the budgeting for the Ministry of Health to make sure that they strengthen their response to cancer in the country. I think it has been properly documented in the new budget for 2021 and I think 2022, even though the situation of the COVID emergency has made it difficult for them to implement. So I believe on paper, the Ministry of Health is very ready to advocate and also to prevent the issue of cancer generally in terms of the cancer centers that are being introduced in the country.
Thank you, Senator Teju Osho. We'll come back to you to discuss more fully on cervical cancer and what your foundation is doing. Let's also now join via Zoom Dr. Ami Bat, whom we earlier introduced, an assistant professor of medicine and genetics at Stanford University. Dr. Bat, I would like also to have your evaluation of the milestones since 2019 on I Am, I Will theme for the World Cancer Day celebration. And this is particularly critical against the background of what the world has experienced since last year. We've often heard that one of the accelerators of fatalities in COVID-19 is the so-called morbidity, one of which is cancer. It appears that this has tended to be a dampener on whatever milestones might have been accomplished in the fight against cancer globally. What are your thoughts?
I think this is an excellent question. As of 2019, Nigeria had a fantastic national cancer control plan that had been pulled together by many different factions, many different parties, and it intended to try and improve outcomes related to cancer, both through cancer prevention, which we heard about from Senator Teju Osho, in the form of methods such as HPV vaccination, all the way up to strengthening the healthcare systems to enable proper cancer care. As a physician and as a scientist and as a doctor who specializes in caring for cancer patients, what I know is that a healthcare system and hospitals that can take care of cancer patients can take care of anybody. And what we have seen is over the course of the stresses of the last year with the COVID-19 pandemic, we have seen healthcare systems around the world struggle to keep up with and maintain good care for patients who have pre-existing conditions, diseases like cancer, diseases like heart disease, etc., all of which can contribute to worsened outcomes with COVID-19. So now more than ever, it is critical that we provide great cancer care to our patients, but also great primary care. Those two are not at odds with one another. One of the things that I like to remind everybody is that doing things like trying to prevent cervical cancer, as we are trying to do in the Cervical Cancer Free campaign, really is not only life-saving, it's also cost-saving in the long run for healthcare systems. And so these are some of the ideas that we're trying to bring to the table. I think one thing that has been highlighted tremendously by the COVID-19 pandemic is the importance of educating our general public about health. It is important that every single one of you at home knows about issues that affect your health. And over the last year, you have learned so much more about your health because of the COVID-19 pandemic. So our campaign and the campaigns of others, including the Nigerian Cancer Society, UICC, the nonprofit I organize, Global Oncology, we all aim to educate the public and give them knowledge, because knowledge about cancer is really power.
Well, Doctor, I'm just being curious here. The fact that cancer has lived with man for decades, yet there's no known cure for cancer. To some lay persons, we've felt that, look, has science actually failed in this respect? Why is it that we have not been able to find a way out to deal with cancer? Now, there's also an apparent rise in cancer cases and deaths globally, especially in developing nations. Now, and again, this one is specific. Why is breast cancer still the most commonly diagnosed cancer today globally?
Excellent question. So, you brought up some very good points, which is there are some cancers that can be cured, and there are other cancers that are not curable. There are cancers that we can prevent through screening and through vaccines, and there are cancers that we can't prevent. So one thing that I want to remind the lay public is that cancer is not just one disease. Cancer of the breast is very different than cancer of the prostate, which is very different than cancer of the cervix. To your question about breast cancer, why are we seeing such an increasing rate of breast cancer? One of the things that we know is that cancers such as breast cancer are increasingly common as women age. And so one of the consequences of improved healthcare systems that decrease maternal mortality, for example, when women die in the early years, often during childbirth, one of the consequences of that is population's age, which means we have more women and men who make it into their 60s and their 70s and their 80s even. And cancers such as breast cancer definitely increase with age. There are probably also other lifestyle factors, such as the foods we eat, our lifestyle, that are probably contributing to these increased rates as well.
All right, thank you very much, Dr. Bat. We'll come back to you in the course of the conversation. Let's bring in Dr. Bello, who, as I said earlier, is a regular guest on Good Morning Nigeria, discussing matters relating to cancer in particular. Dr. Bello, what is your evaluation of the I Am, I Will theme 3 years on for us in Nigeria? Based on your experience on the African continent, are we lagging behind or are we ahead in terms of seeking to contain the scourge of cancer?
Thank you very much, Kingsley. That's a very good question, and it's important we look at the last 3 years and say exactly in Nigeria, where have we been and where are we today? And to be fair to Dr. Tejiosho, one of the key things that he was able to actually do was to make sure that they pass a bill that made it possible for the establishment of the National Cancer Institute, or the National Institute for Research and Treatment of Cancer. That bill has already been assented to by the President since 2017. Unfortunately, it has not yet been established, but he was able to fast forward that, to his credit, really. When you look at the narratives in the last couple of years in Nigeria especially, many things were actually proposed. We were able to establish the cancer control program. We were able to cost it. It will cost about 97 billion naira to implement. That is from prevention to diagnosis and then treatment and then palliation. we have not been able to make any fund available for the realization of the National Cancer Control Program. So that has been really lagging. Last couple of 4 years, I think there was an concerted effort by the Federal Ministry of Health to see that more centers are created. Unfortunately, funding has also been a problem. So when you look at the scenario where we started, I am and I will, we have not really made so much efforts, or we have not made so much improvement in terms of cancer care in this country, in the sense that when you look at the number of cancer professionals, for example, a lot of them have actually been succeeded in leaving the country. So if you look at a country of 200 million people that will require at least 3,000 cancer specialists, we have less than still 100 in this country. When you look at the kind of radiotherapy machines and the number of, say, 200 by WHO standard, we have less than 10. When you look at other diagnostic centers and pathologists, it's all something that is really worrisome. And the COVID pandemic has actually worsened the situation, because most of the funding has actually gone back to funding the pandemic. So a lot of the fund that would have gone to the cancer care and cancer control has actually gone back to the pandemic. You will realize that even the patients are scared of going to hospitals these days because of the fear of contracting COVID-19 infection. So if you are going to give a sincere outlook of what has happened and where we are today, we are indeed in a very precarious situation, largely because of funding. However, there are giant strides that are being made, not only for Nigeria, but globally. The plan of the World Health Organization to eliminate cervical cancer by 2030 is something that this country has taken head on, and they are putting things in place. I know that we had a webinar last year, and the Executive Secretary of the National Primary Healthcare Development
Dr. Abubakar, let us pause you there. We will turn to you. Okay. And because we have guests that will be leaving us in any moment from now.
Very well.
Let's go back to Dr. Zainab Shinkafi Bagutu, wife of Kebbi State Governor, and the founder of Medicaid Cancer Foundation. Madam, when you were making your initial comment, we had the issues with your audio. So we didn't get some part of what you were saying. So, maybe you could just go back to your narration. Let's get to understand much more of what you were telling us. Again, you should add this issue of cancer screening. To what extent, has the foundation gone in cancer screening, especially in Kebbi State? And we were talking about the fact that breast cancer is on the increase this time around. Is that the experience you have over there in Kebbi State?
Thank you. Certainly, breast cancer is the commonest cancer in Nigeria. We do have a screening system in Kebbi done by the state government, and we also have one by civil societies like the Medicaid Cancer Foundation. Nigeria has a national screening program on paper, but this hasn't been implemented yet. There's a committee that is trying to ensure that that cancer control program gets implemented. But like Dr. Bello was saying, some of the funding is an issue, but the government has done a lot in terms of trying to bring it to the forefront. The same thing has to do with treatment. Treatment is also a problem that our patients have. But we have seen the advent of the Catastrophic Health Fund, which I believe we've been told by the ministry that the funds have been disbursed and we will see it get to the patients soon. the distinguished Senator Teju Osho was probably being modest and didn't mention, but he was a very key part of ensuring that this fund is appropriated to the Ministry of Health. And for the first time, we saw the advent of a catastrophic health cancer fund, which is meant for indigent patients to the tune of almost ₦1 billion, I believe. So we will be seeing that coming through to our patients. Without adequate systems in place, a general screening is impossible. But they do have intermittent screenings. The state government of Kebbi has recently concluded a screening for prostate cancer. So it's not just limited to the women, which is the commonest. By all means, we do see more breast cancer cases, and they do come out, but the issue for them is the fact that they are not able to get help. They come out late, by which time the disease is advanced and difficult to treat. And so the general feeling is that if you go to the hospital and you get surgery, you're going to die. It's not the surgery. I'd like to emphasize this as an advocate creating awareness. It's not the surgery that usually ends life. It's the fact that the disease is so advanced. And this is not limited to just breast cancer. Indeed, it's true of all the cancers. I was saying we recently concluded a screening for prostate cancer in Kebbi State across 4 emirates of the state. And it was really surprising that a lot of men came out. Usually we talk of cancer and we talk of breast cancer, and the men tend to be somehow put to the second place or ignored. But for the first time, in collaboration with Johnson & Johnson, we were able to carry out a screening across 4 emirates. It lasted a week. And even after that, so many men are calling, men from high income, low income, middle income, all cadre of life are calling up and wanting to come and be screened. And we realized that a lot of them had issues, but were not able to come forth and openly talk about it. And they were really pleased at this. So I'm actually very excited about that, because I hope that since we have focused attention on the men for the first time, I'll admit, we will be able to get their buy-in to allow us to screen the women, diagnose the women more, and in fact treat them. Because as we all know, we have cultural issues. The women find it difficult to come to the hospital without the permission of their husband. So the state government is doing a lot. We have a costed state cancer control plan, one of the few in Nigeria, and we also have some funding in place to ensure that that is implemented.
All right. On that note, we would like to thank you, Dr. Zainab Shinkafi Bagudu, wife of the Kebbi State Governor. You joined us via Zoom. We appreciate you being with us on the program today.
Thank you.
All right. So let's also go over to Senator Lanre Teju Osho, former chairman of the Senate Committee on Health. Senator Teju Osho, what has been the experience of your foundation in its outreach on cervical cancer? And that experience, of course, we would say, what has been the most challenging aspect, either in reaching patients with cervical cancer or in getting them to step forward for testing, or just sheer attitude of persons who sometimes will believe that we're probably dealing with spiritual matters rather than a medical condition?
Well, my foundation is called LISDEL, and it's a legislative initiative for advocacy for sustainable development. We focus more on the parliament to ensure that the assemblies of all the states and the Senate and House of Reps, the policymakers in the health sector, they do the budgeting appropriation in a way that it has a human face. It's one thing to always turn out budgets every year, but the implementation is also a very important aspect that must be followed through. So most importantly for this cervical the cancer management, we need to ensure that all the wards in Nigeria, we have over 10,000 wards, that the primary health centers are located in all these wards, and people can, within a walking distance, go to the nearest primary health center and even just check themselves, ask simple questions as to why they have certain symptoms that may be the symptoms that would make us confirm they have some cancer developing and so on. So in terms of the reactions that we expect for any patient that has all these symptoms, if there's no institution or any center they can go to immediately, then we will just be putting things on paper that we are not implementing. So that basic implementation of having functional primary health centers is what we are focusing on to start with. Then all the other commodities that they need, they will have where they can distribute them to the potential patients.
Senator Lanre Show, we thank you so much for being part of our show this morning. And of course, we wish you well in your undertakings with respect to cervical cancer. We know you are the former chairman of the Senate Committee on Health. I also want to believe that you're still in contact with those who are still there, you know, since you are still in health business, to see how they will make it possible for us to have it, you know, a lot easier, you know, to deal with issues such as cancer. Thank you once again for being part of our show today.
Thank you for having me.
All right, maybe we have to return to Dr. Bello Abubakar. You know, we caught you a short while ago, you know, while you were doing some analysis of the question put to you by Kingsley. You can just continue from there.
Okay, thank you very much. So I stopped at the point where I mentioned the issue of the cervical cancer elimination worldwide, which is an initiative of the World Health Organization. The Director General wants to, Dr. Tedros, initiated the fact that cervical cancer can actually be eliminated by 2030. And one of the key things that they want to do is in terms of prevention as well as in terms of treatment. Prevention in the sense that they hope to vaccinate at least 90% of the total female population by 2030. And also about 70% will be screened, and then about 70% will be treated. It's a very doable thing if the funding is there, but every hand must be on deck. And I want to believe that in Nigeria, just like Dr. Zainab Bagudu Shinkapi has mentioned, there are a couple of initiatives. One of the key initiatives is the fact that the National Primary Healthcare Development Agency is taking up the vaccination of females with the vaccine to prevent the human papilloma virus infection. And this is very key, and we've been told that this will roll out this year in 2021. And we hope that if that is sustained, definitely we'll be seeing less and less cervical cancers. So this is one of the key things. The other thing that the Ministry of Health has also done is to procure equipment for the treatment of cervical cancer, what is called brachytherapy equipment. Already there are about 10 of them in the country, even though not all of them have been functional in the last couple of years. But it is my hope and belief that this year those equipments will definitely be put to use so that they can actually support the treatment of cervical cancer as well as prostate cancer. So a lot is being done in the sphere of the I am and I will, but a lot also need to be done. When you look at our population, it is something that this country should declare also as an epidemic. Cancer has become an epidemic if it is not a pandemic. And we must engage also the private sectors, because I have always said that government cannot do it alone. We have to create enabling environment for entrepreneurs and businessmen to come and establish cancer centers so that our people will stop going to India and other parts of the world. I have always said that most of the people that can afford treatments are not in this country. They travel abroad. And when they go out of this country, they don't go to government hospitals. They go to private hospitals, because those countries have created enabling environment to have health tourism. So we should be able to do that. There are a lot of bureaucratic bottlenecks in establishing radiotherapy centers, how you import them, what are the key things. and there are no tax holidays for people that want to come into this country to establish cancer centers. And we must make sure that we are able to do some of these things to support government. And if government cannot provide the enabling environment, I don't see us moving forward in terms of cancer care in this country.
Dr. Bello, thank you very much. We'll come back to you in the course of the conversation. One more time, let's bring in the president of the Nigerian Cancer Society, Dr. Umar. Dr. Umar, where are we in terms of the implementation of the National Cancer Control Program?
Well, thank you very much. Well, sincerely speaking, not so much has been done, but we are making progress. The National Cancer Control Desk is very active, and we are trying so much to see how we can increase on the level of our advocacy so that we can have a very robust National Cancer Control Desk at the Ministry of Health. We were there yesterday, and we were well received. You see, it is very pertinent and important to note here that the reason why we emphasize so much on prevention, and early detection is the fact that, over 1/3 of all cancers can be prevented. Another 1/3 can be cured if detected early and properly treated. And we are talking about over 60%. And according to global statistics, over 10 million people are affected by cancers. According to the Global Current 2020 report in Nigeria alone, in 2020, about over 124,000 new cases of cancers were discovered, out of which over 78,000 cancer-related deaths have occurred. So, and these statistics are quite alarming. And we truly need to sit up. We truly need to collaborate. We truly need to involve all stakeholders. And the support and encouragement from the part of the Federal Ministry of Health is very important in this aspect. I'm glad Senator Teju Shaw, the former chairman Senate Committee on Health, was highlighting the fact that his foundation worked closely with the legislature. And it is pertinent to note that the current National Assembly is doing a lot. Just this Monday, some cancer-related bills and some other bills were considered by the Senate Committee on Health under the leadership of Senator Dr. Ibrahim Oloregbe. And inputs were put in by a lot of stakeholders. And there seems to be some commitment towards increasing healthcare funding in general. In the House of Representatives, the National Committee on, the National Assembly House Committee on Healthcare Services and other health-related committees of the House of Representatives are doing a lot. The international, there is currently a cancer bill that has passed through second reading, a bill that aims to establish a cancer control agency, sort of. And these are laudable improvements. These are laudable steps that we all need to consolidate. We all need to come together and forge a way forward.
All right, thank you. Dr. Amibat, let's come back to you once more. For so many years now, and to be precise, about 4 years ago, the focus has been on collective action to the global cancer burden. We'd like to know how effective this has been. Now, you are the director of Global Oncology Stanford Center for Innovation in Global Health and co-founder of Global Oncology Incorporated, non-profit organizations. Now, in terms of synergy and collaboration with other cancer bodies across the globe, how global are these foundations? Are there any form of relationship between your organization and cancer bodies across the globe, especially in developing nations such as Nigeria?
Absolutely. So I've had the opportunity and the great honor of meeting Dr. Bello many years ago when I had the chance to visit National Cancer Hospital in Abuja. We have ongoing collaborations with Lagos University Teaching Hospital, Ahmadu Bello University Teaching Hospital, both in Nigeria, with really impressive staff and faculty and professors, as well as trainees. One of the things that we've been working hard to do is to encourage young trainees, the medical students and the residents, to become interested in providing cancer care so that they can be the future Dr. Bellows of Nigeria. In addition to collaborating in Nigeria, we have active collaborations in Malawi. We've helped to build the first public medical oncology clinic in the Caribbean country of Belize, and we've collaborated far and wide beyond that. Our goal is to identify local leaders such as Dr. Bello and others, and to really partner with them to help them achieve the objectives that they have. And in Nigeria, I think one of the things that we observed was an outstanding education system to train young physicians. And what is lacking is an infrastructure in which they can practice what they have learned to do. And so one of the big challenges of many countries around the world, but certainly something that I observed in Nigeria, is a fantastic education system that trains people who then often leave the country. And so I think part of the goal of building capacity in country to provide outstanding cancer care to not only Nigerians, but more broadly to other West Africans, really involves taking that fantastic education system and pairing it with the resources that it needs to be able to achieve better cancer prevention, cancer care, and palliative care.
Dr. Abibat, thank you very much for the point you've just raised in terms of training of specialists in cancer care and management. But will they underscore that, unfortunately, some of the professionals who get trained do not then have the right infrastructure or environment in which to function, and then they take off. Dr. Bello, with us here at the Abuja studios, already made reference to that we're losing a great number of professionals. And oftentimes, Dr. Bello, we tend to rationalize this as, oh, it's fair enough, they're going for greener pastures, and then our chief concern would then be with diaspora remittances.
True, and that is really quite alarming. I think, like I mentioned earlier, we have to make concerted efforts to keep the people that we need here in-house, in-country, because if policies are not done in such a way that people will remain here, it will continue to be a recurring situation. And believe me, no country will allow their best to be leaving the country just at will. There must be ways of keeping them in-house, whether it's in terms of funding, whether in terms of providing facilities for them to work, whether in terms of increasing their retirement age like they did for the teachers. Now teachers have to, they have the option of staying on till 65 and so on. And these are things that we really need to sit down and look at. We trained about 5 oncologists in the last 5-6 years at the National Hospital. None of them is still around. They have all gone out. They are in the United States, they are elsewhere, and they are in Canada, and so on and so forth. And we need them more than they need them. But the fact still remains that it is very daunting. It is a sad situation when you practice oncology in a country such as Nigeria. Because I'll give you this scenario at the National Hospital. We have 2 functional radiotherapy machines. We have about 7 consultants, and we have about just 7 residents. Each consultant is supposed to train at least 4 residents, but they are simply not there. So you can imagine the bulk. The whole of northern Nigeria has literally no single functional radiation therapy machine. So the whole of the 19 states are sending patients to the National Hospital. And even from the south, from the east, and indeed from other countries, neighboring countries, they come to the National Hospital. So patients are treated up to midnight or at 1 o'clock, and that is putting so much pressure on the equipments. And there is no fund that is specifically meant for maintenance. that is specifically as part of a budget line that is meant to keep these machines going. So they keep breaking down because there is too much pressure on them. Only 2 machines. I mean, in a country of 200 million, and you need 200 machines, and you have less than 10, you can imagine the pressure not only on the machines, but also on the personnel.
And that's the point you were talking about earlier, namely that government alone can't provide the required care facilities, and that you need private investors. As part of the National Cancer Control Program, do we have any lines there indicating that there may well be opportunities for private investors and that this will not be linked to our fiscal policy? Fiscal policy meaning, for instance, that there could be tax holidays, or that when those hospitals are opened, you don't have tax raiders knocking at the doors of the CMD, of the medical director, and say, you haven't paid this money, we're going to close you down, and so on and so forth. Do we have that, Dr. Omar?
Well, sincerely speaking, I don't think so. And it's unfortunate the National Cancer Desk is not here to talk about what they actually have. But I'm afraid we still have a lot of grounds to cover. But the optimism is high, and we believe that...
What is the source of the optimism?
Well, the source of the optimism is the spirit in us, of the I am and I will spirit. You know, together all our actions matter. We are all stakeholders. And as those of us on the advocacy side from the Nigerian Cancer Society angle, we will continue to push the agenda. We will continue to keep it on the front burner so that the relevant government agencies will listen, so that the needful will be done, so that at least we will have a near-perfect system.
Well, a near-perfect system. Well, there are quite some groups, who are, working on the fight against cancer in this country. And I just wonder the level of sensitization that has gone out, to many Nigerians with respect to the causes of cancer, causative factors, as a matter of fact. There are, causes of cancer, known ones. Yeah. Now, how are Nigerians getting the right information with respect to what to avoid, what to eat, and what to avoid? We hear that when it comes to prostate cancer, it's more or less found in black men. I don't know how true that is. Yeah. Right. And again, if you go to hospitals, we find out that there are so many of us, who have gotten this very disease. Some may not be cancerous, but of course the prostate is growing, but not yet cancerous, but it's also disturbing. Yes. So to what extent, have we been able to reach out to Nigerians with respect to, in fact, it's another form of management, informing Nigerians of what to do and what not to do, what to avoid, to be able to stay away from possible, cancer attack.
Yes. Well, thank you very much. You see, this is the reason why there is need for serious collaboration in order to truly reach out to those that truly matter in trying to dispel these rumors, to correct these misconceptions and myths associated with cancers, especially in the rural areas. You see, the Nigerian Cancer Society is the umbrella body of all individuals and organizations that are working on cancer. And we have a lot of them in Nigeria. And to be sincere with you, our cancer NGOs in Nigeria are doing excellently well. There are a lot of them, and they are doing very well. What we lack, however, is that systemic collaboration that will bring out everything we do out in the open. And that is why the Nigerian Cancer Society is here. And we have a renewed energy of trying to see how we can consolidate and trying to see how we can bring everybody on board so that there will be a sincere, forward-looking, collaborative approach so that every activity of our cancer NGOs is brought to the limelight so that people will know what they are doing.
Fine. Dr. Omar, my colleague Kieran posed a question. You say NGOs involved in cancer advocacy or some other issues related to cancer care and management, they are doing a lot. What are they doing? And are they too elitist in their approach?
Well, sir, to some extent, yes. But the reality is there are a lot of cancer foundations, a lot of cancer organizations at the grassroots that are doing wonders. And that is
what are these wonders?
Well, the wonders they are doing is reaching out, particularly to the local population, And you know, like I said earlier, 1/3 of cancers can be prevented. And prevention in medicine, they said, is better than cure. So if 1/3 can be prevented and another 1/3 can be cured if detected early and proper treatment is carried out, it means that over 60% of these cancers we can prevent, we can cure. So that means what happens, especially at the grassroots, not in the capital cities, where the elites are, is actually what is needed, is actually what is necessary. And what we are doing is to ensure that collaboration is the key word. We collaborate, we come together so that all our actions will matter. There are a lot of, since the beginning of this year, January is Cervical Cancer Month, and a lot has taken place. A lot of organizations, a lot of individuals have carried out screening exercises, and a lot are still ongoing. And this is the reason why there is need for us to come together so that we can consolidate and move forward.
Okay, Dr. Adamu Al-Hassan Umar, thank you very much. Dr. Bello, we've talked about breast cancer, cervical cancer, and a moment ago, Kirian raised the issue of prostate cancer. We also hear about lung cancer. What is driving the epidemic of lung cancer? Is it tobacco consumption or environmental pollution in terms of air pollution? And if so, what is it that we are doing nationally to seek to arrest those drivers of lung cancer, particularly in men?
So this is very interesting, the question of lung cancer that is now becoming a very important disease in sub-Saharan Africa, including Nigeria. You know that in the 90s, there were so many legislations that are banning the production and consumption of tobacco in most of the developed countries. So those companies and the tobacco industry moved to sub-Saharan Africa where the legislation was not so much. And as a result, they have established industries around in the name of investments, and people are consuming more cigarette smoke, tobacco. And as a result, we are likely going to have more and more lung cancer in the not distant future. But having said that, I do know that there are legislations and laws banning the consumption of tobacco in public places, even in Nigeria. But implementation has always been our problem. To implement those laws has always been key. And beyond that, when you look at the environmental factor, since industries that are built asbestos, whether they are taking all the necessary preventive measures, wearing masks and making sure that they don't just inhale asbestos and so on and so forth. And of course, there are other things like, when you have radium, if you are building in a place where there is a lot of mountainous areas and so on. So the risk factors are there and they are increasing. And the legislations are also there to prevent those risk factors from coming into our shows. But unfortunately, like most other things, implementation and making sure that the laws are enforced are simply not there. And we are going to be having, when I started practicing oncology over 20 years ago, the truth is that you can hardly see 1 or 2 lung cancer disease in a year. But now the prevalence is really going up, and we really need to do a lot of studies. So, and it still boils down to financing. You see, cancer care is an expensive business, whether in terms of prevention, whether in terms of legislation, and so on and so forth. We must find a way of having an endowment for cancer. That is the only way we can move forward. All this legislation and saying that we have funds for this, fund for that. If you go to the hospital, they are simply not there. They are simply not there, and people are dying because of abject poverty that they can't afford care. They can't.
All right, Dr. Abubakar, well, thank you for that submission. We'll return to you. This is Good Morning Nigeria on the network service of the NTA. We have been tackling the issue of cancer in Nigeria with respect to the 2021 World Cancer Day. We're not done yet. We'll take a short break. When we come back, we'll be concluding the conversation for today. Stay with us.
You're welcome back here, and it's still Good Morning Nigeria, live on the network service of Africa's largest television network, the Nigerian Television Authority. Let's return to Dr. Amy Bath, who is with us via Zoom still. She's an assistant professor of medicine and genetics at Stanford University. Dr. Bath, we can talk about prevention. Well, let me, from a layman's perspective, throw in one or two issues. Earlier, I was asking Dr. Bello Abubakar about the incidence of lung cancer and what we are observing, say, in Nigeria and the rest of sub-Saharan Africa. But we also have, clear environmental issues that the layman would say, if you were to put your head down and say, look, these are probably drivers of some forms of cancer, particularly lung cancer. Fumes from generators, power generators, for instance. I mean, there's probably no neighborhood where you don't have generators, and everyone is emitting all kinds of smoke. And then you also go to oil-producing communities, where there's massive pollution of the waters, and also there's massive pollution of the air. In a place called Port Harcourt, which is the capital of Rivers State, from time to time, they have to do what they refer to as black soot. Any surface you touch is black because of the emissions right there in the air. Are there ways that this can be dealt with? And assuming those ones are dealt with, can we scale down on the incidence of some forms of cancer, for instance, lung cancer?
So that's a fantastic question. As you know, pollution is a major problem in many mega cities, very densely populated cities. Pollution can come from a variety of environmental sources, and most certainly pollution has been related to a variety of lung diseases, not only lung cancer, but other chronic lung diseases such as chronic obstructive pulmonary disease, also known as COPD, which is similar to asthma. We definitely know that certain types of pollutants, for example, asbestos poisoning, et cetera, has been associated with certain types of cancer that can affect the thoracic cavity, such as mesothelioma. And my suspicion is that many of the pollutants that are found in these different environments can be associated with lung cancer. Now, unfortunately, what we know about lung cancer and what causes it predominantly comes from research that is done in a very small number of countries in the world, such as the United States. So lung cancer is the #1 cancer killer in the United States. It is predominantly caused by either smoking or smoking tobacco products, or by genetic mutations that can occur either in the germline, meaning they are inherited from parent to child, or they can happen randomly. We know that pollution can certainly enhance the rate of mutations that can occur, and we thus think that pollution may be an important risk factor in the setting of lung cancer. But I think your question really highlights the importance of doing not only cancer prevention, cancer education, and cancer treatment, but also cancer research. It's critical that we do research to try and understand how these different types of pollution that populations are exposed to might be putting them at risk, not only for lung cancer, but other cancers as well.
Yes, thank you indeed. And back here, Dr. Bello and maybe Dr. Omar could also be, answer this question. That has to do with the research which Dr. Bad has actually raised. How much of this research takes place in Nigeria, especially when it comes to lung cancer and prostate cancer, for instance? And again, I would like to know to what extent has the treatment of prostate cancer been successful in Nigeria? We know that most times when somebody is diagnosed with a prostate cancer, if it becomes cancerous, definitely the person may not survive it. That's the common belief. But I want you to do an evaluation of treatment of prostate cancer, for instance, in Nigeria. Has that been always successful, or do we still have a lot of patients giving in to prostate cancer?
So you've asked many questions actually, Kirill. But let me start by saying that early detection actually will save life. early detection as well as early treatment will always save life. So whether it is for prostate cancer, for any other thing. So patients that present very early are cured, literally. And we have so many patients that are presented early, and that is why if we are able to implement the National Cancer Control Program, we will be detecting prostate cancer very early, and we will be saving a lot of lives. But the implementation is very difficult. One of the key things that we have on that document, which I happen to be part of it, is institutionalization of the screening program for prostate cancer, which is the PSA by the age of 40. So if that is institutionalized, every Nigerian will be encouraged from the age of 40 to just go and do a PSA. And that is almost good enough to be able to detect it early and save life. So your second part of the question has to do with research. Now, my organization, the African Organization for Research and Training in Cancer, is actually saddled with the responsibility to encourage Africans to do research in terms of cancer. And we have a very large membership of Africans that are in the diaspora. And collaboration with other institutions such as the Stanford University. Amy was here in Nigeria many, many times, and they are collaborating with different institutions to do research. We have particularly a consortium called the CAPTC. The CAPTC is spearheaded by a professor, a Nigerian professor, Professor Folakemi Odedino, who is a professor of pharmacology and research at the University of Florida. And she is day in, day out into Nigeria trying to see how we can do research. Because when you look at the treatments, most of the treatments of prostate cancer, like Amy has alluded to, the clinical trials that validated some of the drugs that are being used have not been done even on black people, not talk of Africans. There is a drug that is called abiraterone, which is one of the drugs that is being used for prostate cancer. And we have the highest prevalence of prostate cancer. But when you look at the clinical trial that validated the use of abiraterone for prostate cancer, I think there are only about 2 black people in that whole thousands of people that were involved in the clinical trial. And that is why CAPTC is looking at prostate cancer research in Africans with specific concern of Nigerians. And that has been ongoing. Very soon we are going to have that report. Then there are other research that have been done, like the 54 gene, where a consortium is looking at about 54 genes in the body that are responsible probably for some of the cancers. You know that we say that cancer is a genetic disease. So it's as a result of a mutation of a particular gene. If we are able to pinpoint some of the genes that are responsible for creating, for us to develop cancer in Nigeria, then we will be able to probably develop treatments that are targeting those things in-house. So yes, research is ongoing, but we need a lot of funding. And that is why we need people like Amy that have been so passionate about Africa and Africans, and we are collaborating with them. That's why we need Olopades of this world from the University of Chicago, and we need the Folake Odedinas of this world to come to Nigeria. And that's why the diaspora is very critical to us, that they should come because they get a source of funding, you know, that they will come here and collaborate with us and do research. And we have been encouraging this. In fact, on the 18th and the 19th of this month, we're going to have a conference, the first genomic cancer conference that is organized by the African Organization for Research and Training in Cancer, to look at all that has been done in terms of research, in terms of genomic research in sub-Saharan Africa, and the people that are involved both inside and also from the diaspora.
Okay, thank you, Dr. Bello. Just before we take our choice, I want to come back to Dr. Adamu Umar. Dr. Adamu Umar, earlier I threw in the question whether our focus on cancer advocacy, even the steps to take by the populace, whether the advocacy isn't too elitist. I'm asking this question against the background of some of the things that we see and that we can sometimes casually probably link to the causative factors of some forms of cancer. Let's take a look at our environment. Earlier, we were talking about the indiscriminate use of generators, power generators. Some persons will say, oh, no, there's virtually nothing we can do about that, but a lot can be done. Yeah. But what we eat,
sure.
Around the FCT, there is an epidemic that is not being taken note of, or that is not even being addressed, namely artificial ripening of fruits.
Sure.
We have had cause to deal with that issue on Good Morning Nigeria, where fruit sellers, those who want their bananas to ripen in the next 15 minutes, use carbide to ripen it. You have seen persons who are selling garden egg, the green one, they put it in some solution, bring it out, and it is all yellow. Now mangoes are just coming out. You go to the market, you don't know which one to buy. The sellers will now be the ones telling you, okay, take this one. Yeah. Some of them are green, they're not, right, but others are yellow. When you put it, when you bite it, you know that it is acid that you have taken. So what are we doing with respect to this? When people are roasting meat, they use tires, sometimes pour kerosene on it. What are we just doing with these little aspects that we can take care of about what we consume?
Well, thank you very much. You see, that is part of the societal problems that we have, and that is more reason why there is serious need for attitudinal change by Nigerians, because sincerely speaking, a lot of the habits, a lot of our actions, a lot of what you see on daily basis is very unbecoming, is very unprofessional, and scientifically dangerous. And that is the reason why, as rightly put by my teacher, my senior brother, research is very important and key towards reducing the risk associated with cancers. And we in the Nigerian Cancer Society have an interest of a cancer-free world, a cancer-free Nigeria. We want to see a situation whereby fewer people get cancers in Nigeria, fewer people die from it, and those that have the disease have a better quality of life. And that can only happen when we have a serious attitudinal change, when we sustain and continue with the advocacy of trying to educate the populace on what is good and what is bad. But sincerely speaking, sir, the attitudinal behaviors of Nigerians is very worrisome, especially when it comes to very unhealthy lifestyle habits. That is what I can say on that.
And to add to that, really, you see, there is no country that will not have laws. We think that when we have freedom, when we are democratic, it means we can do anything. Where your own right stops, that's where mine starts. In those days, when I was growing up, we used to have health inspectors that go around the markets, that go around everywhere. If you are building your own house, for example, say outside Lugbe, where they will say it's not yet habitable and all that, the inspector will go and make sure that you have good drainage. If not, he stops the building. All these things are no longer there. And these are the people that will be able to alert the people that will institute sanctions. We don't just have sanctions for anything that we do. So people get away with all sorts of things. And that is why it is catastrophic not to act on this kind of thing that we are talking about. If people are doing unholy things, they should be brought to books. The laws are all there, but putting them in place and putting sanctions to Nigerians is one of the key things that is not just happening. And that is why people can just do anything. If you know that there will be sanction, you go to jail.
for trying to put carbide or whatever to ripen something that you know it is unhealthy. If you know you are going to jail, you will not do it. And you know that there are people. So Nigeria really does not need to have a lot of unemployment. We have so many things that we need to do in terms of getting these people back on track. If we are doing that as a nation, believe me, some of these things will stop. But we must make sanctions. We must be able to do some of these things.
And you know, it's not even only in ripening fruits.
Yes.
There are some preservations that they use to preserve beans and other food items that we eat. They use all manner of substances, you know, for preservation.
Sanctions.
We should not be.
They'll put sniper.
You know,
grains.
Exactly, you know, and potash, you know. So we have tweets here, Kingsley, and I'm not sure we have enough time to go through them, but let's see what we can do with the first set of it. We have says cancer affects millions of people in Nigeria and worldwide. Key factors that aggravate the conditions of cancer patients is poor health system, lack of specialized cancer centers, and subsidized or free treatment for the indigent cancer patients. Addressing this will help a lot.
Billy Jack Solomon, cancer knows no borders. This is why we must take the issue of cancer more seriously in Nigeria. There's a need for proper sensitization on the causes and prevention of cancer.
Mike says, though cancer is a killer ailment, it is not a death sentence. Hope should be given to individuals with the disease by establishing cancer centers in all local government areas of the country. Governments cannot do it alone, so we call on good, loving people to donate magnanimously to this.
Utulo Sunday, I place my emphasis on tobacco. Now, using any type of tobacco puts you on a collision course with cancer. Smoking has been linked to various types of cancer, including that of the lung, mouth, and kidney. Avoiding tobacco and eating a healthy diet, therefore, are important parts of cancer prevention.
Haruna Adamu Balamosi is a deadly disease that needs a swift action by the authorities. Meanwhile, the government should sensitize the populace through the traditional rulers, religious leaders, and health centers across the country. More so, there should be provision for treatment centers in the 36 states of the country.
All right, we have this from Nandom Wuyep. It says, for many patients with cancer, the future is often unknown, and hope is what keeps them alive to endure treatments and social and personal adversities. Hope is supported by the positive attitudes of the medical team and caregivers. All right, Joseph Anunwa is there. Kirian Suleiman Babagana.
Mutana Farouk.
Yeah, Mutana Farouk. Alpha C. Festus Akimboyewa. Josiah Odiale. I'd like to appreciate you for your tweets that have come in today. So on that note, we'd like to thank all our guests who have remained in the course of the conversation. Earlier, we signed off the first two guests. A deep thanks to Dr. Amy Barth, Assistant Professor of Medicine and Genetics at Stanford University, also Director of Global Oncology at the Stanford Center for Innovation in Global Health. We appreciate your being with us on the program this morning.
Thank you very much.
And of course, have a very good evening there in the U.S.
It's midnight.
Thank you. Have a great day.
All right. We also would like to thank Dr. Adamu Al-Hassan Umar, President, Nigeria Cancer Society. Thanks a lot for being around. And we wish you a fruitful World Cancer Day celebration?
Activities.
Activities,
yes.
That's right. That's the right synonym for it.
Yes, thank you. Thank you very much for the opportunity.
Then our regular guest on Good Morning Nigeria, Dr. Bello Abubakar, Chief Consultant, Clinical and Radiation Oncologist, and President, African Organization for Research and Training on Cancer. So,
thank you.
Dr. Bello, thanks a lot for being around.
Thank you so much.
Okay, so that's it for us on Good Morning Nigeria. We're back tomorrow, same time, 7 in the morning. Remember, coronavirus